Hi everyone, my name is Monica, and today I'll be discussing two studies that evaluate the use of diagnostic ultrasound in identifying ACL tears and how it compares to using an MRI. ACL, or anterior cruciate ligament, are injuries among the most common in sports and orthopedics. Accurate diagnosis is key to timely and effective treatment. MRI has long been considered the gold standard for this, but as we'll see, ultrasound may offer a quicker and more accessible alternative. ACL injuries can severely limit mobility, especially if left undiagnosed. It can also result in chronic instability and further damage to the knee. The typical route for diagnosis includes a physical examination followed by imaging, usually an MRI. While MRI provides detailed images of the soft tissue, it comes with cons such as high costs, long period of waiting, and is not always available in certain areas, such as those that are under-resourced areas. This is where ultrasound becomes very much a pro. It's portable, cheap, and it provides real-time imaging. The first study that we'll discuss is the Kumar et al. Study. Took place in 2018. This study was conducted in India and it involved 130 patients who presented with signs of chronic ACL injuries. The researchers used functional ultrasound to assess anterior tibial translation by applying manual pressure to the tibia and measuring the shift relative to the femur. This was then compared to MRI results. What stands out here is the very high positive predictive value, nearly 98%, which means if ultrasound detected a tear, there was a very high chance it was correct. However, the low negative predictive value, which is only 44%, suggests that a negative result does not confidently rule out injury. This is a very big limitation, especially if the ultrasound is being used to avoid an MRI. The second study was by Broekers et al. Took place in 2019, and it was done in the Netherlands, had a much larger sample than Kumar of 247 patients. It was a retrospective study that compared ultrasound results to arthroscopy, which is the surgical gold standard for identifying knee pathology. This study also made an important distinction between partial and complete ACL tears, something the Kumar study did not. They found that ultrasound was quite accurate in detecting complete tears, with a high negative predictive value of 95%. But for partial tears, however, accuracy dropped significantly. This is important because partial tears can still cause instability and may require ongoing treatment, especially in active adults. The difference in methodology between these two studies help examine the difference in their conclusion. Boomer's study was prospective and used an MRI as a reference, focusing mostly on chronic cases. Brooker's study, however, was retrospective but had the advantage of comparing ultrasound findings directly with arthroscopy, which is even more definitive. Also, Brooker's used a more comprehensive ultrasound technique, evaluating both direct and indirect signs of ACL injury, and even attempted to distinguish subtotal from partial tears. This level of granularity makes it a stronger study when it comes to evaluating an ultrasound's limitation. Both studies suggest that ultrasound is a helpful tool, particularly in identifying complete ACL tears. It can be used as a first step in diagnostic process, especially when MRI isn't available or is delayed. However, in most cases, with partial or borderline tears, ultrasound becomes less reliable. Therefore, it really should not fully replace an MRI, but rather complement it, particularly in triage or point of care situations. The takeaway is that while ultrasound shows promise, its role is currently limited by sensitivity issues and operator dependency. From what I've learned, I believe ultrasound has a strong future as a frontline screening tool, especially in emergency department, sports clinics, and under served areas. It offers quick and relatively accurate assessment for a full ACL tear and can help streamline care. But I also do think it's important to be cautious, especially in patients with persistent symptoms or when partial tears are suspected. Following up in such cases with an MRI is necessary. Diagnostic decisions should never rely on one tool alone. It should also take into account clinical examination, patient history, and follow up testing. Ultimately, incorporating ultrasound more widely could help reduce unnecessary delays and improve access to early care. And these are my references. Thank you.